Hi, I'm Kendall. I'm the Marketing Director at Vein Specialist of the Carolinas, and I'm here with Dr. Drawn to educate you on compression garments. So what exactly are compression garments?
Well, compression garments are a fairly recent invention within the last century by a man named Jobst, who was an inventor and an engineer. And he had terrible venous disease. He had venous leg ulcers from a very early age. And he noticed that when he was in a pool or in water, deep water up to his waist or chest, that the pressure of the water made his legs feel better. The pressure difference with the higher pressure down lower in the water, pushing on the legs, helped his legs. So he designed a garment that would mimic the gradient of pressure in water. So as the water gets deeper, the pressure gets higher. And the higher pressure pushes fluid from high pressure to low pressure, and so it actually pushes blood up the leg and helps your legs, your veins in your legs, empty. So garments simply are an adaptive mechanism where we put a garment on your leg and it's high pressure here, lower pressure here, and it just simply pushes the blood up the leg against gravity.
So do compression garments get rid of my symptoms, or will it heal my venous disease?
Well, both. Compression garments can alleviate symptoms for many people, but not everybody. And they work by being tighter at the bottom and looser at the top. They're not just tight. They have a gradient of pressure, so they actually help the veins empty the blood out of the leg. And that can help with the heaviness, aching, swelling, tiredness, restlessness, cramping. The garments can help your symptoms, but it doesn't change the fact that the one-way valves in the veins are still broken and still backflowing. So they compensate, and they can be a good enough compensation that they can improve your quality of life. They can improve the swelling, the skin damage, and actually venous leg ulcers heal with compression. But it's only a compensation for the problem.
So are there different levels of pressure in garments, and how do I know what level I need to be wearing?
Yes, there are multiple levels. The levels that you get at the drugstore that are not prescription are not usually enough pressure gradient to help. The lowest level of medical treatment is a gradient of, we call 20 to 30 millimeters of mercury. So it's between 20 and 30 millimeters of mercury at the ankle. That's the initial level we use in our practice. It is the first level that is considered medical therapy, and 30 to 40 is probably the ideal pressure, but it's very difficult to learn to wear 30 to 40 right out of the bat. So I like to put everybody in 20 to 30 first, and those that need more will go up if we have to.
So why are athletes wearing compression garments now?
Well, they wear compression for the same exact reason that people with venous insufficiency. So when you're exercising and moving your muscles and pumping all that extra blood in there for the activity, then you also have lots more venous blood that needs to be emptied out. And so compression helps empty the venous system of the blood that has the lactic acid and carbon dioxide and all the waste products. So compression is thought to help athletes recover quicker and not have post-exercise soreness and achiness and symptoms like that.
Do I need to wear compression garments before I receive treatment?
So most insurance companies require that you try compression garments for at least 3 months. A couple have gone to 6 weeks, and one insurance company has actually dropped the requirement altogether.
So if the insurance companies are requiring that I wear these garments before treatment, do they actually cover the cost of the garments?
Well, just like all insurance policies, they're all different. But yes, there are insurance companies that will cover the cost of garments. Some will cover the garments with a copay, some will cover it with an office visit, and other insurance companies will cover them 100% out of the box, no matter what, 100% covered. And many will cover up to 6 pair of garments per year. And most garments will last at least a year of daily use. Now, Medicare will cover garments, but only if you have a venous leg ulcer and only if the pressure of the garment is 30 to 40 millimeters of mercury.
After I receive my treatment for my varicose and spider veins, do I need to wear compression garments then? And if so, for how long?
Well, the way I like to explain to patients is that you're putting a significant investment into your leg vein health. Part of that investment is time, part of it is money, and part of it is the pain of the procedures and the recovery, which isn't terrible, but nonetheless it's an investment that you're making. And if you want to protect your investment and have it give you the best result for the longest amount of time, I'll recommend wearing compression garments lifelong.
Do you require me to wear it after treatment?
We require compression garments after treatment for a different reason. And after we've treated your veins, we've basically injured the vein so that it will scar shut and go away. Now, we want the vein to scar shut. We don't want it to fill up with blood. So the compression garments help keep the veins empty so they scar shut quicker and easier and don't get trapped blood. So after you get your procedures, we like you to wear the garments 48 hours, non-stop, don't take them off, to get the maximum benefit of emptying the blood out of the veins.
Am I supposed to wear garments while I'm sleeping?
Well, there's been some confusion and myths about compression garments that you can't wear them while you're sleeping. The real truth is that compression garments simply counteract gravity, and they push fluid uphill. Now, when you're lying flat and sleeping flat in bed, gravity is not really pulling the blood down. So the blood empties from the legs relatively easily. So you don't need them as much at night, but they're not going to hurt you to wear them at night. They will continue to squeeze your leg. If you have swelling that is difficult to go down overnight, then they will continue to help move the fluid out of your leg while you're sleeping.
Is there anybody that should not be wearing compression garments?
Yes, there is. Patients who have blocked arteries, or PAD, peripheral arterial disease, their arteries have blockages that limit the amount of blood getting to the leg and the foot. And if you put too much pressure on the leg from the outside, you can decrease the arterial inflow. Now, there's only a very small population of arterial disease patients that can't wear garments. Most people with mild to moderate arterial disease can still wear compression if veins are also a problem. But we should always check your pulses, make sure they're able to be detected before putting you in garments. And if your doctor tells you you have blocked arteries or PAD, or you have symptoms that are suspected of being arterial, you probably want to let your doctor check you before you wear garments.
Thank you, Dr. Drawn, for answering these questions about compression garments. We hope this gave you a little more education on compression garments. If you are interested in seeing all the different sizes, colors, and patterns that we offer, we have a link on our website and you can actually order your garments directly from there. Or please feel free to call our office and you can order your garments over the phone and we will ship them directly to your house.